Let's remain in the Ashanti region, and authorities at the Manhyia District Hospital are expressing concern over the state of the hospital as it is bedeviled by poor infrastructure. They are thus appealing to stakeholders and benevolent individuals for support to improve healthcare delivery. Citi News' Ashanti regional correspondent Doris Lonta has more.
Manhyia District Hospital is one of the busiest hospitals in the Ashanti region, apart from the Citi Teaching Hospital. Despite its massive contributions to healthcare delivery in the region, the hospital is challenged with poor infrastructure, as most of its units are housed in wooden structures, posing challenges to quality healthcare delivery. The medical superintendent at the facility, Dr. Kamaldeen Hussein, shared some concerns with Citi News.
Quite a number of units are still housed in a wooden, makeshift wooden structure. So we are only asking that those of you who know those who can assist the facility, let them come to the aid of Manhyia, because those wooden structures are actually not fit for purpose, especially this time of, what do you call it, Agenda 111 that we all have in other facilities. You come to Manhyia Hospital, you realize that the administration block is housed in a wooden structure. You go to the lab is also in the wooden structure. The surgical ward, the entire surgical ward, and we also have a maternity annex, it's also in a wooden structure. Then you also go to the public health unit, it's also in a wooden structure. So, and as I said, we don't have a purpose-built emergency unit, okay, and diagnosis center, no purpose-built diagnosis center. So these are things that we need assistance if we really want this hospital to be really a functioning district hospital. So all these things have to be added, including accommodation for staff on the premises.
Dr. Kamaldeen also raised concerns of congestion and limited bed space at the maternity block, which mostly resulted in patients lying on the floor and in the corridors after delivery. The medical superintendent lauded the Otumfuo Foundation and the Joburg Foundation for collaboratively extending and commissioning the maternity block to provide a comfortable delivery space to enhance quality health care.
This maternity extension, basically has increased the number of beds that the hospital has for maternity cases. In the past, we were having about 24 beds capacity. So this 24 bed capacity has now been increased to 40 beds capacity. And as I said in my speech, before you come, you see that labor cases are on the floor, on the corridors, and it is really not good enough for quality healthcare delivery to our people. So this extension will actually improve the quality care that we are giving to our pregnant women. We also have a theater inside this new building. So this theater will also enhance our response to the emergency care as far as maybe cesarean section and other emergencies are concerned.
The board chair of the Otumfuo Foundation, Nana Professor Oheneba Boacheje Owahini II, and the Chief Executive Officer of Joburg Ghana Company Limited, Joseph Mate, shared some insights about the facility after the commissioning exercise.
It is a district hospital that was built in 1962, and for the maternity part, they are pretty much matching the number of maternity cases in the Ashanti region, but they only have 24 beds. So there are a lot of mothers and children, newborns, who don't have beds, amenities, and it's quite appalling if you had been here 2 years ago. It is still continuing, but so Lady Julia envisioned that we should increase the capacity of the ward. So with the cooperation of Joburg Foundation, the Otumfuo Foundation built this maternity block that we just commissioned, and it's a 16-bed facility. It's more modern than the previous one. So it serves a very significant purpose in terms of maternal and child care.
Part of our responsibility and part of our initiative to help the communities and develop Ghana is to improve healthcare and also give people the needed shelter they need to accommodate them.
Otumfuo Foundation, in collaboration with Joburg Foundation, have expanded and commissioned the Manhyia District Hospital maternity block. This initiative is to provide a conducive delivery space for mothers. Reporting for Citi News, I'm Doris Lonta, Manhyia, Ashanti Region.